Hello and welcome to Health Tech Builders. Here we explore the business of health innovation through real stories from leaders in the trenches, the wins, the failures, and everything in between. You will get insights and practical advice to help you build and lead in health tech. I am your host, Rodrigo Hute. Hi everyone and welcome back to the podcast. Today my guest is Dr. Erica Armstrong. Erica is the founder and CEO of Root, and Root is a growing and very successful virtual functional medicine clinic in the US, nationwide, across the United States. And today, in today's episode, we'll be talking about Root as the company, but also the role of functional medicine in today's evolving healthcare ecosystem. So, Erica, welcome to the podcast, and thank you so much for your time today.
Thank you for having me. I'm excited to be here.
I would like to start, Erica, to better understand the functional medicine space. So how do you define functional medicine, and what sets it apart from other areas such as primary care, health and wellness clinics, longevity clinics, integrative medicine clinics, and so on? It seems to me that there is an overlap in all of these sectors or subsectors. But I would love for you to explain at a high level, how do you see functional medicine and what differentiates functional medicine with these other areas that I just described?
Sure. At a high level, the way that we would define functional medicine is finding and treating root causes. That's why we're called Root. And so that is the idea of functional medicine, is to really dive deeper, look at more advanced lab testing and put the picture together for people, like connect the body systems instead of, seeing different specialists for every body part and no one talking. In what we're doing in functional medicine is figuring out what's driving the illness so that we can reverse it whenever possible. So in my background, I have a little bit of a unique perspective because I've seen the conventional space. I was a practicing family physician for years, and I do see a little bit of the overlap there. We do not replace primary care. We're there to complement our primary care colleagues. We really sit as this layer as functional medicine specialists. And so our team is actually board certified MDs and DOs who have had a past experience as primary doctors. And that's really important because in primary care, you do train in all the specialties. And so you know how to put the picture together for people. And then they've trained in functional medicine. And then when they come on board to Root, they actually go through our Root residency, because over the years, we've figured out, almost had to invent how to practice functional medicine. There's a lot of differences out there in patient experience. And so clinicians are physicians, and they're also dietitians. And so one of the core features that is a differentiator is that nutrition is foundational to functional medicine. So it's pretty rare to have a dietitian in your primary care office, right? So usually that's a referral out, and maybe they're not as collaborative because they are not in the same office, they're not in the same exact team. And with Root, since day one, we have been a doctor and dietitian duo, and it's part of the reason that we've been able to use nutrition as our first line whenever possible, instead of just reaching for the prescription pad, even though we are medical doctors and are licensed to do so. And so at Root, functional medicine is delivered by doctors and dietitians.
I love that. I strongly believe that health starts in the gut, and nutrition as one of the most important pillars. So that makes total sense. But the follow-up question is, how is it different from other health and wellness clinics, integrative medicine clinics, even longevity clinics? I see a lot of clinics especially in the US. There is a lot of different clinics that they say, claim, or even do some of the things that you are mentioning.
Sure. I mean, there's a lot of variations out there, and I think, tacking functional medicine on to something is very different than being your sole focus and your sole model of care because you think about scope and breadth of practice, like to do something really well, it should still be like the focus in the way that you run your business and the way that you run your care model, the way you hire, the tech that you build around it, like everything to make this a very efficient running model should be built in this scope of practice. And so we're functional medicine specialists. We don't try to do primary care. So we're not dealing with, acute things and then the next minute trying to solve a very complicated puzzle for people. We do stay in our focus in functional medicine. And then, you do have longevity. A lot of people do confuse like functional medicine and longevity. And absolutely, what we're doing is going to contribute to your longevity. It's going to make you a happier, healthier person now and in the future. That's the point of treating root causes and not just band-aiding things. But our real value at Root is that we find early detection of chronic disease risk factors, people who already have chronic disease, and we help them reverse it. So we're really the chronic condition solution. We use functional medicine principles in order to be able to do that.
That makes total sense. Thanks for clarifying that. And how would you say patients are making decisions on where to go? If I'm a patient and I'm looking you know, for a health and wellness clinic or a functional medicine clinic, do you think patients already know that if I have a cardiometabolic disease or high cholesterol or whatever, I already know, okay, I need to go and find a functional medicine doctor versus going to a health and wellness clinic versus a primary care physician? Do you think patients, consumers are already well versed in understanding the differences, or how do patients find you? Let's put it that
Sure.
way. Yeah.
So, consumer awareness for this type of medicine, for functional medicine, for more holistic medicine approaches, is just exploding, especially in the last 2 years. But I would still say, even still, like the primary driver for where you choose to go is word of mouth. Because if you think of like the lack of consistency that's out there between these practices, like different practitioner types, different treatment types, different outcomes. That's hard to understand where you should go as a consumer, and word of mouth is very powerful. In some ways, a lot of people are still choosing their local physician because they've had a friend with, a positive experience, and that's very meaningful. We are not a local practice. We're online in 49 states, but we still have word of mouth. We'll talk about how the business has evolved over the years, but we have word of mouth both now with individuals and with companies through the network that people are in when choosing their benefits.
Okay. Thank you for that. I was going to say that at least in my experience, like most, me as a patient, you either go to a doctor that you already know and the doctor has reputation, or someone uh, gave you a good recommendation or a referral to a clinic. So I I would agree that word of mouth and also the physician's reputation, it's one of the key drivers. But I'm also curious, and we can talk more about this later on when we talk about patient acquisition and marketing. But I see a lot of influencer marketing and a lot of direct to consumer marketing that it's helping and creating a lot of noise. And I'm curious to hear your perspective in terms of how effective that is. Um, but uh, but yeah, why don't we tackle that now that we're
Sure.
talking about that?
Well,
Was
thankfully, we are not in the D2C marketing channel anymore. We don't run any ads for direct to consumer, even though we still have individual memberships. Our focus is really educating people, connecting with those in the employer benefit space, creating real outcomes, because outcomes and real cost savings kind of speak for themselves. And when you help not only restore the health of an entire organization, but save them money while doing so, that word gets around. And so because of that, we haven't had to go into the kind of influencer area that a lot of our competitors are in. It hasn't been our focus.
Okay. But there is a role for that, right? There is for sure if
Absolutely. And you can,
yeah.
yeah, you can definitely, we've seen like some of our, I don't really think we have competitors because we're in our own category that we created, but some others in the space have definitely had success in that route. I think, we tried it a little bit when we were mostly a D2C practice, but it's difficult and it's expensive, and I don't know how sustainable it is long term.
Yeah. All right, so let's talk about root. How would you describe root in a few sentences?
Root created the category Root Cause Health Benefits. We are an employee benefits platform for the delivery of functional medicine in order to reverse chronic conditions at the root cause. You can tell I've said that before.
Yeah. And I want to ask you, like, let's say that if a well-funded competitor, let's say someone raised $100 million, $50 million from a top VC firm in the Bay Area, and they decided to launch a clone of Root tomorrow, what could they get wrong?
Hmm. Where do I start? So the first thing they would get wrong is completely underestimating how complicated this is, from every level, from clinical validity to years of actual real outcomes, to quality of care, to the tech platform needed, to how to even get into the employee benefits space and then create a offer that makes sense for the employer and that also like can help you continue to sustain yourself as a business and hire the best people. It is a lot of levels, and then actually making sure that that program, works and people engage and you onboard them correctly. There's just a lot of details that this isn't something that you're gonna like. You just use AI and figure it out. It's a lot of trial and error. It's a lot of years. It's a lot of real outcomes. So yeah, I think there's many ways to get it wrong.
Uh, can you talk a little bit about the membership model? I think I've seen that on your offerings, and that it looks different from a traditional fee-for-service model.
Sure. We've that's one of the things that hasn't changed. We've always been a membership business since day one. And the main reason is that health happens outside of visits. We need continuity. Need to engage people between visits, and just kind of engaging and billing at that point of service really isn't creating long-term change. And so we really wanted to be able to support people when they needed us. And so that's why we've always been kind of a recurring membership. And it's evolved in like what's included and price levels and feedback on what people wanted for sure. But that individual membership is still in existence. And so that people will have a membership to our platform, access to our team, our interpretations on labs, etc. It's just part of the whole program. And then on the employer side, it is kind of like a membership, but it's more of an employer sponsored program, but there's a lot of overlap between the two. It's more tailored to, what the employer's goals are, what their budget is, and where they're at as a company for that member experience. But it's still the concept is the same. Support people throughout their journey and not just episodically.
Are membership plans organized by health outcomes or clinical protocol or objectives? So, for example, metabolic health or hormones or boosting energy. Is that how you organize it?
We definitely have our core areas, where we're helpful, and they tend to be the top cost drivers and the top things that people are experiencing. And so when we bring an employee on that's sponsored by their employer, their experience may be a little different first on what the employer program has sponsored. But secondly, they're still in the same program, but they may experience it a little bit different from their coworkers based on their own personal goals and their own health goals things that they're experiencing. So for example, we treat gut health, autoimmune, hormone, metabolic, migraine. Those are our top five. We can really help anything except for active cancers. But so the number of times that they engage with our team, both doctor and dietitian, and the labs and such that they may do, are driven by our protocols. So we actually have 34 protocols that we've measured and tested over the last 3 years. So it is guided, but it's also personalized because there are real humans that are listening and meeting people where they're at.
You offer, I think the first step is to get a comprehensive testing. You call it whole body lab panel, if I recall correctly. Uh, do you include most biomarkers, and how are you able to get competitive pricing versus what you would get elsewhere?
Sure. We use a root cause panel. We've come up with it as a clinical team because it gives you a lot of value for one blood draw. It's 9 vials, very comprehensive. It's all the key areas that you need to get started with a functional doctor. It works very well for employer accounts because it's the right amount of information and things that people will actually do. And it gives us the triggers to move people into the right level of care for them. So it's looking at nutrient levels, inflammatory markers, blood sugar markers, more detailed metabolic panels, full thyroid panels. So we find a lot of things that have been undetected over the years just right off the bat, and that really helps both get people engaged and help get them to the doctor and dietitian that can help them start to reverse those things. Oh, and the second question you asked was how do we get the competitive pricing? This comes from being in the industry for years. Just had relationships as a practicing doctor and was able to get direct contracts through some major lab companies.
All right. Okay. Okay. That was my question. So it's not that you are also a lab company. You partner with labs in different companies and okay. All right. Do you offer a weight loss program like such as GLP-1s? Are you also focused on in that area?
I wouldn't call it specifically like a weight loss program. I mean, we're always focused on root causes, so insulin resistance, inflammation, hormone balance. When we fix root causes, a lot of times the weight just comes off. For example, when you lower insulin levels, insulin's a fat storage hormone. So when we treat insulin resistance, those levels drop. People are able to lose weight more efficiently. We can prescribe GLP-1s. Our doctors have medical licenses. We just tend to do so a lot less because, like I was saying earlier, like nutrition is our first line therapy. And so we really nail that before we kind of just reach for the prescription pad.
When you look at the 15 clinical protocols or so that you mentioned earlier, I'm curious about how do you measure outcomes? How do you measure clinical outcomes? And I would imagine that there is a difference between showing the ROI to a patient versus showing the ROI to an employer. How does that different? How is that different?
I mean, the ROI to the patient is they feel better. They can enjoy their life again. They can do things that they weren't doing before. And so that one's actually easy because, most people are very happy when they, have results and it's so subjective. For an employer, we're measuring all kinds of things. We're measuring actual lab improvements from start to and progress throughout. We are measuring things like getting people off of really expensive medications, and the number of cases that we have of people being able to do that and the cost savings that are related to that. And lastly, we can actually measure real claim savings in real time. This isn't some extrapolation of data. This is like before root, this is what you were spending. And then with root, this is how your claims dropped. And here's why. We stopped all this bounce around to specialists. And every time you visit a specialist, what happens? You get testing, sometimes procedures, sometimes medications. And a lot of times you still are left without an answer to what was actually driving it. And then you bounce to the next specialist for the next body part issue. And those two specialists didn't talk. So if you think about what's happening in the conventional system, which I saw up close and personal because they would end up back in my office and say like, I'm not really better. I've got these medications. Should I even be taking these? Like, what can I do? And those are real things that Root has shown that we can do over the years that we can actually measure.
Very interesting. And I have a follow-up question on the patient side of the ROI equation. You said that it's objective and based on how they feel. What role those retesting have in making a patient believe that they are making progress? So sometimes I agree with you. If you feel better, then that's super clear. But sometimes you don't feel anything, and then you retest, and then your numbers, your levels either improve and go down, or they stay flat, or they get worse. So the question I have is like, how how in terms of patient engagement and retention from a business perspective, how much is retesting and looking at the hard numbers from your biomarker data? Um, it's an strong indicator of uh, clinical outcomes and health outcomes.
Sure. I mean, in the patient or member's perspective, like quality of life, that is our goal. We want you to be able to thrive in your life, and if you feel better, you can do that. But it's also really great when you can show people on paper, like this is what your efforts did. You know, you went from this inflammatory score or marker, like an HSCRP of over 10, and now you have normalized it. And what did that do for your future? So it really makes them feel good about the work that they've done because the proof is in the numbers. So that definitely helps too. But I would say if I was a patient, my primary goal is not, reducing my HSRP from 10 to 1. It's like, let me go and enjoy being with my kids and be able to be fully productive at work and present in my life. That would be like my number one thing. And then, oh, that's awesome. That also reduced my, inflammatory score while I was doing it.
As if the number, I would imagine that there are cases where the numbers do not change a lot. If patients do not see that those numbers change dramatically, and they feel slightly better or kind of the same, would they say, "Oh, this is not working. I'm going to go and do something else"?
I mean, they always have that option, but health is a lifelong journey, and a lot of times we don't change things overnight. I mean, sometimes we can make some changes very quickly, like certain things we intervene can make people feel better in a week, sometimes a month, but other things are trickier, especially if you've been struggling for a while. And sometimes those improvements are more modest. And a lot of times we used to say this a lot when I was practicing and seeing patients more, but sometimes it's 2 steps forward, 1 step back. But who's on your side during that 1 step back? That's the membership model. That's having a doctor and a dietitian to coach you through. And so I think that's one of the reasons, that human component, although we're a tech-enabled, we're an AI-enabled company, but having the humans is part of the stickiness.
Yeah, yeah, that makes sense. I also wanted to ask you about the pros and cons of being a local practice. And we talked about the benefits. If you're local, you create more word of mouth, you see people in person, um, have local relationships, uh, and it helps, right? If you are in person or you have a hybrid model, you can leverage those interactions to build trust versus being a national virtual telehealth platform where you're covering uh, many states and it's harder to build trust, virtually. Um, so what, and I know that you have done both. So I was curious to uh, learn from your experience, like what are some of the pros and cons, and what have you learned from being on both sides?
I'm sure that there's definitely pros and cons here. I mean, having a local doctor that you can sit with in person is extremely valuable. And, I don't deny that. I think it comes down to scale. Those practices are wonderful for direct to consumer, especially for very complicated people who would would value that actually sitting in the same room with someone, that can be healing in itself, right? Like if you're sitting with someone, the physical presence can be very powerful. That's really difficult to do at scale and to affect the number of lives that we want to affect. There's some pros and cons. So like, we still pick up a lot of things on video. And a major pro of being online is that we see employees. We see all industries, manufacturing, construction, software engineers, finance, all different people from all different walks of life, and we meet them where they're at. So sometimes they're traveling, they're at a sales conference. Sometimes they're literally at a gravel pit or on, popping in over their lunch break while they're at their manufacturing business, and being able to meet them online right on their phones keeps them on track. They don't have to drive in, they don't have to take work, they don't have to wait for me. We're right on time. It's a click of a button, and we meet them where they're at.
Yeah, there is definitely convenience. Have you seen a difference in the average member lifetime, the time that a member stays with you or in these practices? If you think about a local practice versus a national telehealth, if you think about patient retention in month 3, month 6, month 12, have you seen a big difference? And how would you, and not only Root, but you can share numbers if you want, but if not, what have you seen in the industry as being kind of common numbers?
Sure. I mean, I think when you change someone's life, even if they're not actively working with you, you're kind of always in the back of their mind. And so like if they need help again, they're going to come back to you. So that is a little bit different on the D2C side. I would say there probably, in our experience, is more turnover on the D2C side, just because when you solve someone's problem, they don't need to see you every month, which is awesome. That's the goal. That's what we want to do. When you work with employers, it's much more population level, and we need to make sure to continue to keep the cost savings there. So we need to check in on people that we've already helped. So we don't want them to slide back down, end up back on more meds, end up regaining weight. So there's just a lot more flexibility with employer accounts, in that, new people are coming in, they've got new problems to solve. People are already in a better spot, but we don't say goodbye because we don't want to put them back, to where they were.
If you think about the evolution of Root as a company, what are some of the things that some of the things that have worked well for Root, and what are some of the things that haven't worked well? And if you could do it differently, what would you do differently from the start?
I'm going to I guess I'll put these kind of coinciding. When you're a startup, you try lots of different things, and you get feedback, and you iterate quickly, and you change very quickly because you need to keep growing, and staying the same does not keep you growing. So I think a lot of pivots early on, almost. And when you think about it from some of the people who have seen us for a while, that maybe it was causing some confusion on what we're actually doing these days. That's pretty typical, I think, for a startup. But on the other side, what would I do differently? What we did last year when we did this full B2B pivot is something I would recommend to any entrepreneur. And I know you have them in your audience, and that is create a category. And so what I mean by that is create something so differentiating that when you think of that category, you think of your business. So like Uber or Lyft created the ride sharing category. Airbnb created the renting your apartment category. And Root created a new category of health benefits, where we layer on as functional medicine specialists. And we actually, it kind of fell in our laps. We didn't realize we had created it until we were standing at all these conferences, and we were the only ones doing functional medicine care delivery. And we thought, wow, They created a category here. Like, yeah, this is a way to offer functional medicine to people at scale. And let's go ahead and name it. There's a book I'll recommend. It's called Play Bigger. Every entrepreneur should read this. It's a quick, fun read, and it talks about category creation and what that does for both your team in alignment and setting rocks and working towards one common goal, and also externally for messaging and clarity and mission. And this is what your company is set out to do.
So if I wrote it down, is it Play Bigger? Is that the name of
Yes,
the book? Play Bigger.
yes.
Got it. Okay, I'm gonna get a copy of that book. Thank you. Uh, so at what point did you realize that the original direct-to-consumer model wasn't going to scale for you, and hence pivoted to employers? Was it specifically something that broke, such as, the unit economics or the operations or something else?
I guess I wouldn't say it wasn't going to scale. Like, people have certainly scaled D2C functional medicine practices. It was just the impact that I wanted to have and the ability to give people access to functional medicine that never would have had this if we didn't make that pivot. So entire populations of people were taking on, never heard of functional medicine, didn't know nutrition could help them. And watching that change in those people is extremely inspiring to our team and to everyone else that they work with a lot of the time, like people change in community. And so it was more so a level of impact and really a mission that I had. I knew this kind of medicine worked, and I built Root because more people needed access to it. And this is how we can do that at scale.
Okay, that's very interesting. I thought you had hit a wall in the D2C space. I mean, some companies do, but then also some companies also hit a wall on the employer side. So it's not that B2B, it's better or worse or easier than D2C. It's just that, if I understood correctly, it's that you want to have a different impact.
Yes.
So okay, so if you think about CAC, like customer acquisition costs, how did that look for you when you were focused on a direct to consumer model? Do you remember? I know that it was a while ago, but what was your kind of average acquisition cost, and how it is today? If you think about employers, longer sales cycle, you may need probably sales people instead of just marketing campaigns. So what can you share on that?
Yes, it's been a long time since we've run an actual ad, so I don't probably don't remember what our CAC was back in the D2C. I think it's been over 18 months since we've had any ad spend. We were never big on it though. It was really word of mouth, or organic searches that people were finding us from, even nationwide, like because of our content, they were finding us. And we were also one of the early people in this space, so that helped a lot. But now, people say B2B is like zero CAC-ish, right? Because you don't really spend ads in the same way, but it's more so like pounding the pavement, getting out there, cold outreach, warm outreach, inbound, and then nurturing them. And yeah, I mean, right now, the stage of our company, we are seed to Series A. We're right in the middle of our Series
Mhm.
A. And it's founder-led sales. And, we're going to grow our sales team. That's one of the reasons we're in the middle of this raise. I'm not sure when this is going to air, but and yes, so that cost is probably going to go up, but right now it's just like founder-led sales, and that's zero CAC-ish.
Yeah, all right. So you're in the middle of raising your Series A, right? Okay, good luck, and hopefully this episode can help you reach more people. Um, what's the bottleneck today if you try to 10x your company?
I think, a bottleneck can be in a couple different. Operationally, I've said this before, but health happens in between visits. And so I see, we're AI enabled, we're tech enabled, we have automated engagement and pings and emails. But part of the stickiness is a human. And so having a human reach out to you is much more effective than an automated ping. And that is one of the operational things that I'm going to actively solve for as we get larger and larger accounts, is account managers, actively, hiring RN care managers, because they're great at this. I worked with them in my family practice office. So that, I think, is one of the areas we need to think about, is continuing to have to deliver this excellent quality and engagement that Root is known for. And then I think, secondly, if you think about bottlenecks on a strategic level, it's like, okay, what we're doing is working. Do we keep doing this, or do we go to the next big thing? Because we're also, have to constantly innovate. And as you know, like, things are changing. You're on the, the AI board. So, and how much do we let AI assist us? And when do we pivot when things are scaling up and working?
What are the most, and we're going to talk more about technology later on, but what are, now that you mentioned AI, what are maybe some of the two most impactful things that you are super excited about adding to your company? If you were to implement one or two new initiatives or workflows or products that are AI driven, where would you spend your time on?
What we're already doing is helping make clinicians enjoy their jobs more, making them more efficient, giving them the tools that we, without AI, would be doing very manually, and not just our clinicians, but our admin team, enabling a lot of our core processes. That's really helping us scale up and take care of more people. And it also enables us to focus our time and attention on more complex people, because we can help people with the assistance of AI, depending on their level of need at that time. So those are the things I'm excited about, is the impact both on clinician health and wellness, because that's a thing. Like, I'm a family doctor. I understand how those types of processes can lead to burnout, and also to just impact more people and do it with consistent quality, and using our Root protocols so we keep everything really consistent for them.
Yeah, yeah. Yeah, I've heard that same similar response from other founders. I think empowering physicians, providers, nurses with real automation tools to free up their time so that they can spend more time with patients, and also free up their time, period, so that they are not drowning in admin stuff. Yeah, absolutely. So now that we are talking about providers, I wanted to ask about some of the things that I've been hearing about, some of the biggest operational challenges as you scale a company like Root. It's the hiring and retaining providers. So can you talk a little bit about, like, how do you see the current state of hiring, managing, leading, and retaining healthcare providers? Maybe share some of the strategies that have worked for Root, or that you have seen in the market in terms of compensation. What's the right ratio of providers to patients, members? And then a follow-up question to that is, how do you, as you scale, how do you keep clinical quality consistent especially when you don't have all of these providers in the same office?
Sure. I mean, you could take this all the way to how the model is actually, like, actual care model is important too. And like, I know a lot of our competitors have had turnover. Knock on wood, we have not had that at Root. And I think it's multifactorial, but it starts with the care model and giving our clinicians something sustainable they can actually do, and that empowers them. Doctors are independent thinkers. We're driven individuals. We made it through residency, and trying to take that away is also part of burnout. It's not just the charting stuff. It's like, how do we set our team up for success so that they can feel empowered and they can feel like they're directly contributing to the success of the people that they're taking care of. And that starts with how you set up your care model, and then how you interview and hire those people that are going to thrive. And so it's a match. It's like, business model is aligned, the incentives are aligned, and the people who are working for Root have this mission. They understand that functional medicine is powerful. They've experienced it either themselves in their own lives, or they have seen it affect patients' lives. So hiring the right people and teasing that out is also very important. And then taking care of them once they're here. Like our docs, we collaborate every single week on our tough cases. Most functional medicine docs are out on an island. They have this small practice. They don't have anyone they can call. They're being innovative on their own. They're inventing how to practice this, and they don't have another specialist they can just call, hey, what would you do with this? And I think that's that support that our team has is very key. Next thing I'll say is like having dietitians on the team, amazing. All of our docs would say we'll never practice functional medicine without a dietitian again. Because having two people working together for an individual is really helpful, especially when you complement each other. So you've got your medical experts, we're making diagnoses that have been missed, we're interpreting lab results with high skill and years of experience. And then we've got a food as medicine expert, the people who are driving the first part of the treatment plan. And so there's a real feeling of mutual support that our team has. I would say all of those things. I also think that hiring is one of the most fun things I do because I love giving doctors this, great place where they can both be themselves and bring their unique traits and passion for functional medicine into something they can sustainably do for the long term. So yes, that
And
was a very long answer to your question.
No, thank you. That's the level of detail that I was hoping for. And follow-up question, why do you think so many of the, I've seen many other telehealth companies struggle with provider retention?
I think a lot of them have contractors. I just know from being in the industry. And so sometimes contractors have multiple jobs, and that's part of it. I think, most of our team we bring on, they're employed, they're fully bought into the Root mission, and they're fully supported. And so I think that's a couple of the reasons that other companies have struggled. And I think we have a very clear purpose for what we do at Root. People who want to practice functional medicine and they want the support and knowledge and protocols and things that we've developed in order to support them to do that, like they should work at Root. And that's a very clear proposition for someone looking for a job.
Makes total sense. I forgot about this that I was asking you earlier. How do you keep the clinical quality consistent?
Yes. Well, we have a whole Root residency. We have our Root protocols. When the people first start seeing members here in visits, we actually go over them with them. We make sure that their wellness plans are reviewed, and they actually are drawn just from our protocols most of the time and then personalized. We get feedback from members. And we just continue to have really close contact. Our chief medical officer does a great job with this.
Okay. And what's the role of health coaches in this industry? And I really do not, are all of the dietitians that you're mentioning, they are like certified dietitians, or could there be an opportunity to also work with health coaches in a practice like yours, or what's your
Sure.
opinion?
Yes, our dietitians are licensed dietitians, and they are focused on nutrition therapy and using food as medicine as their first role. But nutrition, especially at Root, is more than just what you eat. It's lifestyle factors, it's being stressed before a meal, it's activity, it's exercise, and they have functional training as well. So they definitely hit on all of those aspects and not just nutrition. I think health coaches do a wonderful job. They could be a great complement for people working with Root. It hasn't been part of our model that's been working for us.
Okay, thank you. Wanted to ask you about regulation. What's top of mind for you when you think about the regulations impacting Root and your industry?
Sure. I mean, healthcare is a highly regulated, as it should be. I mean, we're dealing with people's lives, right? But there's so many layers to this, from corporate practice of medicine laws and making sure we're compliant there and having actual medical services by PCs. And then there's privacy and security and HIPAA. And then when you think about employers, there's a lot of things to think about with that too, and different fund, like are they self-funded, fully insured, and how do we set up the program compliantly? And then there's all kinds of rules, and this is why this is the other question you asked me, like what would they get wrong? They will completely underestimate a lot of this like deep knowledge set, like even how you devise an employee benefit plan, you could be at risk of, certain things like ERISA or HSA rules, and just multiple levels. That those are some things that we've learned through an amazing team, the right consultants, and also just having like deep healthcare experience and being in the system. You just kind of know where you learn that where the things could go wrong.
Yeah. Let's finally, before we wrap up, I want to spend a little bit of time talking about data and technology. You mentioned that you are a tech-enabled company. Root is a tech-enabled company, and you are leveraging AI as well. So let me start by talking about the data collection aspect, because you start with a comprehensive lab testing. You're getting lots of data from labs. You're also getting data from patient conversations, and I would imagine clinically validated questionnaires and so on. So how are you pulling this data and connecting this at scale?
I mean, I think, the platform has a lot to do with that, being able to integrate with labs to get the raw data to appear for the own members, individual dashboards, and tracking their own improvements. I think those integrations are really helpful. And then we also integrate with EHRs. And so, through safe harbor rules with AI, we can actually pull in some key parts of the medical history and when making some of these lab interpretations. So I think those are a couple of key integrations that are helpful at Root.
And who does that? Is that, the physician that it's treating the patient, and they do that, real time, or before a consultation, they just, they receive the lab results, and it's already automatically updated in your EHR, or is there a separate workflow for that?
So there is always a clinician in the loop at Root. Whenever we're giving any medical recommendations, there's a clinician behind that, even if it's AI assisted. And so that helps us with not having to type so much and coming up with this template and things like that. And also just pulling in the right data very quickly, but it's always overseen by a clinician. So it's teed up for us, and then we can use that and send it back out to the member.
And in terms of your technology stack, what are some of the key components that you have in your technology kind of strategy? And I also wanted to ask you about, when does it make sense to leverage off-the-shelf software tools that already exist versus spending a lot of time building custom-made platforms? And I know there is pros and cons, but just wanted to learn from your experience.
That's a great question. And we have a blend. RootOS we built from scratch. It's not third party. It's developed in-house. We have amazing engineers and designers who have helped build it from scratch. But yes, we still use third parties, and they're very helpful at getting you off the ground, because you don't want to just build a bunch of technology you don't know if people are going to use or not, right? You have to be able to show that your people are growing and there's actual use for it. And then you figure out when you've hit the limit on customization of a third-party software and you're scaling up, it's probably time to replace it. And so we've been doing that as well as building RootOS from scratch. The integrations that are hitting their limit, sometimes it gets time to replace them.
All right. So do you use outsource IT provide consultants and help for like freelancers, or do you have like full-time technology team in-house?
Full-time software engineers, technology team in-house.
Okay, that should be very helpful for sure.
Yes, definitely.
All right. So two more questions before we go. One is the next one is what companies do you believe are building successful telehealth platforms in the US? You know, some of the companies that I've, you know, in addition to Root, you have companies like, Hims and Hers and Raw, and they are not necessarily, I'm not saying that they are functional medicine. I'm just kind of thinking about the telehealth landscape. Um, I've also heard about Tia Health for women's health, and you have Parsley Health that I think they claim that they are also in the functional medicine space as well. Uh, so can you talk a little bit about the kind of competitive landscape in that broader telehealth space, and who do you believe is doing it well and building successful platforms with impact?
As far as competitors, I'll go back to my category creator statement. And when you're a category creator, like you really shouldn't have competitors. People may be doing pieces, but if you are creating your own category, Root is the functional medicine benefit for companies or the chronic condition specialists that use functional medicine to reverse their chronic conditions at the root cause, right? So that's what we're doing. And some of the other names sound familiar, but I think there may be more D2C focused. I'm not sure. I don't know all of them, but I will say, like, I'll throw out a couple of companies that I admire. Lyra Health, they're a mental health company. I
Yeah.
think they're amazing. I think functional medicine would be a great partnership for them one day as we affect that gut brain axis. So if anyone from Lyra listening, send me an email.
Yeah.
And then secondly, I've always admired Maven Clinic. I love strong female founders. I admire her and what she's built and the way that she's done it with purpose for families. I think it's wonderful and inspiring.
Amazing. Thank you. And my final question is, how are you using AI? How you are using AI personally, like in work and on in your life? Is there a specific use case or an agent that you have built or something to help your personal life or work?
Currently, I'm using a blend of OpenAI for chatting on my phone and Claude Cowork, but it's essential. I mean, the amount of things that I can get done in a day is just drastically different from even 6 months ago. So
So
definitely my work day.
you have OpenAI and other tools open in your computer all the time, and it's your thinking partner.
Essentially, yes, that and Claude Cowork is amazing at creating documents. So yes.
So yeah, 100% agree. All right. So, Erica, just want to thank you again for your time. Thank you for sharing your wisdom and your experience with us today. I truly appreciate it, and I wish you and Ruth all of the best. I am a big believer in functional medicine, so I'm going to be watching closely your how the company evolves over time.
Well, thanks so much. It's been a great chat with you today, and thanks for your support.
Thank you so much. Goodbye.